a COVID-19 virus, but it's an inactivated form of the virus. So it is unable to replicate, it's unable to cause harm. It just delivers instructions to the immune cells to start to produce antibodies. Now, the vaccines do not change your DNA, and that's, I think, an important point to highlight. And they are also proven to be safe and effective. Now, when we are talking about doses, the Johnson & Johnson is a single-dose vaccine. So that means you only need to get one dose of the vaccine for you to then be fully vaccinated. When we are talking about the AstraZeneca, you will need 2 doses to complete the regimen. So the 2 doses, in essence, are given roughly 8 weeks apart from each other. And the same thing with the Pfizer. You need 2 doses. And with the Pfizer, there's roughly about 21 days between first dose and second dose. And with the Sinopharm, it's also 2 doses, and you need about 21 to 28 days between the first dose and the second dose. And then, of course, what's important also is to note that for you to be considered fully vaccinated, it's only 14 days after your second dose. You can also actually get a booster of the COVID-19 vaccine, and this is offered as we now have learned from a growing body of scientific evidence that immunity decreases over time. And many people who, got their vaccination as soon as the vaccines were available in Namibia in 2021, these are the people now that we are targeting for booster doses for the COVID-19 vaccine.
Dr. Kandetu, let's...
Yes.
Yes, please continue.
Yes, no, I think that is it. I've tried to unpack, but really try to unpack using quite simple, non-technical jargon. Right. The only thing I didn't touch on perhaps was age. So, for example, the Johnson & Johnson vaccine and the AstraZeneca vaccine are available for people aged 18 and above. Right. And then the Pfizer is available for people aged 12 years old and above. Yes.
So let's talk about then the underlying health conditions and perhaps any side effects when taking a COVID-19 vaccine.
Okay, so if I may just start again and say, the COVID-19 vaccines are recommended, of course, for the eligible population that is now, if we're talking about age, usually 18 and above, but for the Pfizer it's 12 and above, and specifically recommended or especially recommended for people with chronic illnesses. Now, this is because with chronic illness, as we have now seen, you can get severe disease from COVID-19 in infection. So, for example, chronic illnesses are diseases like hypertension, diabetes, HIV infection, previous lung disease, and so on. Cancer is also on this list. So we do recommend it for people, especially for people with chronic illnesses, because these are the ones that more often than not get severe forms of COVID-19. So the vaccination then will help to reduce your chance of serious illness. It will help reduce your chance of ending up in a hospital or ending up admitted in an ICU, or even ending up dying from COVID-19. The COVID-19 vaccines can also be given to people with underlying conditions, as I mentioned, such as high blood pressure, diabetes, as well as pregnant and breastfeeding women, in addition to the elderly. Yes. And then it's important to also take note that these vaccines, they do not cause a person to become more ill or more severely ill if they get COVID-19. This is a misconception that has been circulating in the media. It is actually protective, so
Right.
it prevents you from getting severe illness.
Which brings me then to the next question, Doctor. Talking about popular misconceptions or misunderstandings, what popular misconceptions and misunderstandings are there that about the vaccines that you perhaps would like to set straight?
Okay, so as you mentioned, really there are some people who like to share false information about the COVID-19 vaccines. So it is important, really, and I would like to get the record straight. It is important to know that COVID-19 vaccination will not stop you from having children. The vaccines will not change your DNA. The vaccines do not contain a magnet or a microchip. The vaccines will not increase your appetite or cause you to gain weight or all these other sorts of things we've been hearing in the media. The vaccines also will not kill people or reduce the population. I think that's a misconception that I've heard quite a lot about over the last couple of years. So really, this is one that I really wanted to spend time to stress, that the COVID-19 vaccines are not there to decrease or to reduce the population or to kill you. In fact, it's there to protect you. The COVID-19 vaccines also cannot give you COVID-19 infection, as I have alluded. So these are really some of the misconceptions that are out there and that I wanted to get the record straight about.
Right. Now, at this stage, we have gathered enough data since rolling out our vaccination campaign. Talk to us about the stats. I mean, the uptake of vaccination, number one. Number two, the vaccine of choice. And number three, COVID-19 related deaths or vaccinated individuals versus non-vaccinated individuals.
Okay, so according to our latest national situation report, which covers the periods 19 to 25 December 2022, but of course it's also a cumulative reflection of the epidemiology. Over 500,000 people in Namibia are fully vaccinated. And this translates really to about 28% of the eligible population. So this is quite still low, and it's a number that we are very, very keen to boost, to increase the COVID-19 vaccination coverage in order for us to achieve herd immunity. Then I think the other stat that I would like to touch on is the vaccine of choice. So, but before I do that, it's important to take note again that all vaccines in Namibia are safe and effective. The vaccine that people choose depend on their age. As I've mentioned earlier on, if you are between the ages of 12 and above, you would then probably want the Pfizer. if you are between the ages of 12 and 18, you would probably want to opt for the Pfizer. So we would probably see less numbers of people getting vaccinated with the Pfizer vaccine because it doesn't cater to the majority of the population. And then the other thing is that the vaccine choice also depends on what is available at the facility at the time of your visit. So some people may want or may find it more convenient, for example, to also choose a single dose vaccine so that they don't have to come back again to get a second dose. In such instance, they may want to choose Johnson & Johnson, and then others just prefer a 2-dose vaccine. So it's important to note in Namibia, we don't restrict anyone to a specific type of vaccine. Depending on your eligibility, you do have a choice of which vaccine you want to take. So generally speaking, because we initially in 2021 started off our national COVID-19 plan with the Sinopharm and the AstraZeneca, those are the doses that we are seeing or the numbers that we are seeing are sort of high when it comes to people choosing which vaccine they want. So that is to say, we've recorded high numbers of Sinopharm versus, for example, the AstraZeneca versus, for example, the Pfizer. And that could really just be attributed to the fact that that is the vaccine that we started off with. Yes. Then coming now to the COVID-19 related deaths. So since the beginning of the COVID-19 pandemic, we have recorded 4,082 COVID-19 or COVID-19 related deaths. And of that number, which really sort of translates to a case fatality rate of roughly 2 to 3%, which is below the global average, so it's a good thing. Of that number, more than 93% of those deaths were recorded in people who were not vaccinated. So the overwhelming majority of the deaths that we have recorded were seen in people who were not vaccinated. Yes.
Well, Dr. Kandetu, let me thank you so much for speaking to us and for giving us all that information tonight.
You are most welcome. And if I may just add to encourage really the Namibian population to, if they are eligible to get the vaccine, if they have not yet received the COVID-19 vaccine, to please go out and get the vaccine to protect themselves from severe disease and to protect their communities.
Thank you very much, Doctor, for that.